Hi, my name is Brittany and I'm going to demonstrate how to do a sterile dressing change on a central line on a patient. I'm getting ready, and of course I've washed my hands, I've done hand hygiene, I put on a mask, and I've explained the procedure to the patient. So now we're going to get started. What you'll need is a sterile dressing kit that has chlorhexidine gel. Make sure that the patient is not allergic. Gauze, a sterile dressing and skin protectant, sterile gloves, a mask for you, and a mask for the patient. So this is an old dressing. We're going to take off. We're going to clean for 30 seconds, dry for 30 seconds, and then apply a new dressing. So I'm going to take off carefully. And I'm doing this with clean gloves right now. These are not sterile gloves. You may have to go slow. This may irritate the patient's skin. And of course, for pediatric patients, we want to explain we may need a parent to help hold the child and a child life specialist in the room. Again, we're doing it slow and gentle. If we have adhesive remover, sometimes we can use that as well. And these rip pretty easily too, so you can rip them. Okay. I'm gonna now take off my clean gloves. They're now dirty, and I'm gonna throw them in the garbage. And I'm gonna put on my sterile gloves, and I'm gonna just look, and I'm gonna examine the insertion site. Insertion site looks clean. There's no redness, no drainage. There's no pus. It all looks great. So I'm putting on my sterile gloves. I take my chlorhexidine, and I'm gonna clean. So I clean for 30 seconds around the insertion site, and I'm applying friction. Friction is what's gonna get rid of any bacteria that's in and around the site. And I'm scrubbing and I'm cleaning. 30 seconds clean. Now I'm gonna let it dry for 30 seconds. The drying part is also very important because that's what also is killing the bacteria. It's letting the skin rest for a minute. I'm gonna put on my skin protectant. Put it around where the sticker is gonna go. And now I'm going to apply my dressing. This dressing is a normal Tegaderm with a chlorhexidine gel that keeps the insertion site clean and sterile for the week that the dressing is on. So the gel, again, over the insertion site. And I take it off. I'm gonna name and date, of course, right there. And one thing also to know is you never want to blow or wave in front of the line. That would cause more bacteria. You just want to let it air dry normally. I would name and date this. It's good for a week unless it's visibly soiled, then we'll change it sooner. And that is how you change a sterile dressing.